Passing the NCLEX require being able to handle certain questions that are very challenging. In this psychosocial integrity question, they're very hard, difficult, but I'll walk you through. We use common sense. We find the answer. Keep track of your record. Let me help you pass your NCLEX. Let's get to it. First question. It's a next generation form of question. Don't worry. Just read it, analyze it, figure out what is wrong with this patient. Number one, a client was recently diagnosed with what cancer after undergoing multiple diagnostic tests. We're going to use common sense. During the assessment, the client laughed inappropriately, one word, right? That's key. Avoid discussing the diagnosis, that's the client, and tells the family members. The provider probably mixed up the results with someone else. Something should be going to your mind if you know that what is wrong with this patient? How is this patient acting? I feel completely healthy. I'm okay. They're lying. It's not me. The client refuses to discuss treatment option and insists on returning to work immediately. What do you think? You've seen patients like that. Some one word should come to your mind. It's not magic. It's the same thing. Don't overguess. Is this rationalization, displacement, projection, and denial? What defense mechanism the client is exhibiting? It's not something you never seen before. You know it. What do you think? Rationalization, displacement, projection, denying. What is the patient doing? Stop the video, pick your answer, put it down in the comment, keep track of your record, and then let me know. Will you pick your answer? You can tell the patient is not making excuses. I can tell you the right answer is denial. What does that mean? The patient never accepts the results. If they accept the results, it becomes rationalization, then make excuses out of it. But there's no acceptance. The patient is not displacing their bad feeling onto anybody. They're not accepting the results of that diagnosis. Neither are they projecting something on somebody. The way to answer this kind of defense mechanism, the words make sense. So try to interpret the words in the simplest form. This is a denial. Therefore, that's our right answer. Which behavior should the nurse anticipate? A nurse is caring for a client diagnosed with what? Histrionic Personality Disorder. When you hear the word, that's your buzzword. Understand histrionic. Even if you don't know it, look at the answer choices. If you recognize the symptoms that is not histrionic, eliminate it. Patient will display grandiosity and expect constant admiration from the others. Do you think histrionic patients do that? They avoid close relationship and prefer what? Solitary activities. Demonstrate dramatic emotional outbursts and attention-seeking behavior. If I am histrionic, do I do that? And I show what? Unstable relationship and intense fear of what? Abandonment. You don't pick your answer right away. You pick the answer choice and you look at it. Histrionic, would I do that? Option D. You pick your answer. I know you pick your answer and you pick the right one because C is the right answer. Why? They are very attention seeking. They wear red dress in a party that is supposed to wear white. They wear yellow hat. Everybody will see them when they show up. So attention seeking and emotional outbursts sometimes can be confusing, but that's what they do. They want attention. So any little thing, there's emotional outburst. What did you pick? I hope you not pick D because D is unstable relationship. These people, it has nothing to do with relation. It's about them. And they don't have intense fear of abandonment. Why would they fear you? They want you to pay attention to them. So they will show themselves up. How can somebody who is attention seeking avoid close friendship? So B is wrong. And they don't pamper themselves. Just because they're taking attention, they're looking for attention, they're seeking attention, does not mean they have grandiosity. They are not narcissistic in their behavior. They don't push anybody down. Therefore, C is your right answer. Another personality disorder, what should the nurse suspect? Read it, see which personality disorder it falls under. The client live alone, one word. He has few relationship. Who does that? Prefer solitary activity or connected. I want to be alone. And show little interest in social interaction. I work alone. During the interview, the client speak in the flat tone and state, I really do not enjoy being around. Everything is centered by social isolation. Which patient do you think? Like I said, I'm trying to break it down so that you can see the common sense aspect of the question without not memorizing. Do you see something that is consistent with that? I can tell you this is a Schizoid personality. Look at what I'm going to do. Dependent. There was nothing in the question that this patient is looking for attention and depend on everybody. Neither are they splitting and they're having emotional outbursts about things and unstable relationship. There's nothing there. Antisocial is a trap. Why? Antisocial, they break rules, not because it's not about relationship with other people in society, or they don't want to be with people. People always make mistake. Antisocial means you break rules, you're against norm. Therefore, this is schizoid. It's the beginning. We have schizoid, schizotypal, and then they develop schizophrenia. So it's a spectrum of schizophrenia patient, and this is schizoid. So if you don't know, I want you to memorize it. So the clue is prefer isolation, limit emotional expression, detach from relationship, and little desire for social interaction. Which thought process alteration is the client exhibiting? The next is assessing a client with schizophrenia. During the conversation, the client states, the Flanderbergs are watching me from the wall. If you look at it, you can figure out the clue, but this is the trap. Is this loose association, word salad, clang association, and neologism? I'll show you a trick when you see these questions. Like I said, these are one of the hardest psychosocial integrity questions I've made, but I want you to know how to answer them. Even if you don't understand the question, look at the words and say, oh, loose association. Something is loose. They don't tighten it each other. Word salad. Salad has a bunch of ingredients in it. They don't come together to mix to make it sound. They will be together, but it doesn't make it sound better. It's different from loose association. I'm coming to you, but there's no tightness between us. Clang association. Look at the word clang. Something is rhyming. And neologism, I'm making up words. It's not there. But even if you don't know D, you can tell by just listening common sense. You say, loose, word association, and then clang. All these are wrong. I'm going to choose D because that's the right answer. How do you know it's D? Have you heard about Flanderbergs? I know somebody said, well, I've never heard. I thought it's a true word. Well, when you see things like that, you can ask yourself, have you heard something like that before? Bugs are not Flanderbergs, right? Bugs are called bugs. They don't call them Flanderbugs. So that's the trick from there. It's a false word. The patient is making it up, neologism. Which disorder should the nurse suspect? Okay, a nurse is assessing a college client who avoid one, classroom presentation. In psychosocial integrity, don't mix them. Every word count and see how they relate to the diagnosis. I have avoid class relationship. Oh, then put them in the group. Become visibly anxious during social interaction. You say, this person would like to go to places, but then he get anxious about it. And report intense fear of being embarrassed in front of people. So this going closer to people make me feel bad. It's different from I don't want to go there. I want to go, but now when I go, I can't function. I state, I worry about people are constantly judging me. That's what the patient is saying. And frequently avoid group activity and public setting. You see, I don't go, not because I do not want to go, but I don't go because I'm very worried about being shamed. That's how you analyze the common sense aspect of the question when it comes to psych nursing, psychosocial integrity. Not a fully good answer choice you picking. Which disorder should the nurse suspect? Now look at each answer choice, every word count, break it down into two, and take the words as one and put it together to see if it matches. Obsessive, compulsive. Do you see that in the question? Is the patient obsessed about anything, doing something and being compulsed to do that? She wants to go, but when she goes, she doesn't feel good. So she decided to retract. General anxiety disorder. I'm worrying about everything. There's nothing. This is saying I want to go to some place, but when I go, I can't function. Social anxiety disorder. Oh, I see social. I go to outside and then I become anxious about it. Panic, of course. Panic is an event that you panic about it. It just happened all of a sudden, not just because you went there. There's no going there to have a panic attack. You can have panic attack everywhere. Therefore, social anxiety disorder. This is the way you answer question. You can see that the answer choice pop out like a candy to you, right? Right there. What is your score? Halfway. I know you get 5 out of 5. Which client is at highest risk of suicide? If you get this question wrong, I'm okay with that. I will explain it to you next time when you see it. You will not get it wrong because there's a key concept you have to grab here. And next is assessing the client what in a mental health clinic, a bunch of them. They all have mental health problem. A client with major depressive disorder, he reports what? Hopelessness is a buzzword. Become what? Unemployed is also bad word. And live alone. These are all risk factors for suicide. A client with bipolar disorder, mental health problem, history of substance misuse, bad problem. Impulse behavior, bad problem. It doesn't take medication, all bad problem. Patient schizophrenia is unemployed, bad problem. Unemployment is a risk factor for suicide. Is socially withdrawn. There's nobody there. Suicide. And then divorce. There's nobody to support you. Suicide. A client with generalized anxiety disorder. I'm worried about everything and I have chronic worry and difficulty sleeping. That patient can sit behind. Now, 1, 2, 3. ABC. If you got to pick one, which one would you pick? I want to know. Question 6. Which one did you pick before I reveal the answer? And if you don't know, that's fine. But if you know, pick your answer. But if you don't know, I want you to write this down. The major risk factor for suicide is previous attempt. Nobody has attempted this. So ABC is fine. You got to have a plan. That's number 2. None of them have a plan. There's no indication in the question. But the third one is impulse control. If you can happy, you don't have impulse control. You can do it right away. That's a problem. Followed by substance abuse. You can see bipolar patient who has impulse control. You can't control them. All of a sudden, they can change their mind and they do something and they abuse drug. Boom, they're gone. Those are the things. And the last one is command hallucination. Those 5 things, when you see a question about suicide, that's the way you go about it. Who has a plan? Right? Who has already attempted this before? Who has impulse control? Who has substance abuse? And who has command hallucination? Bipolar patient, he has impulse control. He doesn't take his medication. You don't know when they're going to act. But if you get it wrong, next time I know you got it. And I explain everything. These are the questions I use for Adapt NCLEX Q Bank and on demand. If you want it, you can join our on demand. The website is linked in the description. You can check it out. Number 7. And this is assessing a 1-year-old child during routine clinic visit. The nurse notes several physical findings during the assessment. Which findings should cause the nurse to suspect possible child abuse? Select or reply. There's specific features that can tell you that this patient has been abused, especially in the child, whether physically or emotionally. NCLEX wants you to know. So for pause the video, pick whichever you think is consistent. Is a select or apply. Don't over-select. Pick those that you're 100% confident. There's bruises in different stages of healing. There's retinal hemorrhages. There's spiral fracture of the humerus, and there's multiple healed rib fractures. There's small bruises over the shin. Which one do you think is consistent with child abuse? Pick your answer. Question 7, select apply. Don't over-select. I can tell you, this is the most common one. The bruises, some are new, some are old, different stages. That's what they mean. Retinal hemorrhage, maybe they shake the baby, so there's bleeding in the eye. The spiral fracture is the most common. And then here, rib fractures, multiple, is the same thing as the bruises. Think about multiple rib fractures as what? Bruising. Some are healing, some are already healed, some are new. And E, don't get trapped about it. And I want you to write it down. Bruises over the shin, over the knee, forehead, and chin are normal because kids, they will fall down, they hit their chin. When you crawl, the bruises in the shin and the knee, they will fail. Their forehead is the most common. So when you see questions about child abuse, if there's wound in this location, it's a trap. Don't pick it. So that's the key fact. And that's what I said. Bruises over the knee, chin, shin, and forehead are normal. And this is my favorite. And this is assessing a client with schizophrenia. Which statement by the client demonstrates word salad? Oh, blue, train, apple, window, run softly under what? Paper shoes. Is that word salad? I like music because books remind me of what? Clouds. What do you think? Is that word salad? The government plays camera inside my television. What do you think? Tick-tock, rock clock, my sock talk. What do you think? What do you think, guys? Which one is word salad? Sorry, I'm laughing. It's funny. Which one is word salad? What do you guys think? Put down your answer and let me know. But you can see this, there's no relationship. Word salad, the words are like all over the place. You can't mix them together. It doesn't taste good, right? Tick-tock, rock cock, and my socks talk is a slang, right? The clang repetition, right? That's clang repetition. Gavin plays camera in my head. That's not disorganized thought. These are usually what? Schizophrenia kind of thinking, delusional. So that's off. And then I like music because book remind me of clouds, right? These are loose association. Therefore, one is the right answer. And this is caring for a postpartum client who state the baby cried too much and appear ambivalent towards the new baby. Which action should the nurse prioritize? New baby, mommy said baby cry, and so I don't care about it. What would you do? What is your priority? Assess the client for signs of postpartum depression. Encourage the client to ignore the crying baby. Tell the client that all new mothers feel this way. Separate the newborn from the client for most of the day. This is Psychosocial Integrity, Psych nursing, NCLEX practice question, NCLEX practice test. Put down your answer. I expect you to get 8 out of 10 at minimum. That means 80%. And when you're on top of the NCLEX, what do you think? New mom, had a baby, baby cry, I'm not taking care of it. What would you do? Which one would you prioritize? Assess for depression. Encourage the client to ignore the crying baby. That's no, we got to find what is going on to the baby. Tell the client that all new mothers, no, all is nothing to do with NCLEX safety and individual patient. Separate the newborn from the client for the most of the day. They need to bond together. Therefore, that's your right answer. There's two things: assess for depression and assess for impaired maternal infant bonding. This can progress to postpartum mood disorder. And then the last one. And this is caring for a child with autistic spectrum disorder who engage in head banging behavior, keep on banging their head. What will you do? Safety. Which intervention should the nurse include in the plan of care? Select and apply. Provide a safe environment with padding as needed. Identify triggers associated with the behavior. Use protective equipment if prescribed. Maintain a structured daily routine. Restrain the client for prolonged period to prevent injury. Reinforce alternative calming behavior. What do you think? Which one is appropriate? We want to provide safety. How can we provide safety? Pick your answer. Don't overselect. But I can tell you, one, bad or any object you think they can bang their head to. Figure out what is causing the problem. Trigger. If they have helmet, give it to them. Protective equipment. Structured environment that is consistent with their behavior. If you restrain the kids, it's going to get worse. And then alternative behavior so that they don't bang their head. If they want to clap, clap instead of banging your head. 10 questions. Psychosocial integrity. NCLEX Psych nursing. NCLEX practice question. NCLEX review question. I expect you to have 8 out of 10. If you need more, I've linked the other videos